last thing in the reproductive system is just to compare and contrast the male and female sexual response. Interestingly, in your textbook, the female sexual response is not covered at all, and the male sexual response is. So I'm covering both of them for you. And we'll do it by way of comparison contrast to look at the things that are similar and the things that are different in males and females. Not surprisingly, there's going to be a lot of similarity because, of course, there's a lot of homologous structures involved. So let's start with just what we call the arousal and plateau stages, and we're just going to lump these together. What happens in males, what happens in females, both with their genitals and with the rest of the body. In both sexes, during arousal, the nipples may become erect. There's what's called the sex flush, and the sex flush sends more blood to your skin. It also causes your lips to swell a little bit and your pupils to dilate. In addition, typically speaking, you'll get an increased heart rate and increased blood pressure, increased respiration, which is called hyperventilation, but I'm not meaning you're going to pass out, and increased muscle tone associated with this. And then what's different in males and females here? So in the female arousal and plateau stages, what you are going to get is what we call vasocongestion or erection of the bulbs of the vestibule. Remember the erectile tissues that were actually around the vagina, the bulbs of the vestibule. And that increases blood flow and tightens the opening to the vagina. You also get increased blood flow to the labia majora. The glands and the paired corpora cavernosa and the clitoris will swell. And then the clitoris will actually stand up by a similar mechanism to this. Okay, the clitoris is smaller, but it has the same mechanism. And so the clitoris will swell to 2 to 3 times its unerect size. So here's the clitoris when the woman is not aroused. It can actually swell and become erect. And then the lower 1/3 of the vagina will tighten, in part because of the bulbs of the vestibule. The uterus actually changes position. The uterus is generally tilted forward when a woman isn't aroused. When she is aroused, the uterus tilts back, and the cervix sort of withdraws from the vagina. And the vagina will actually have extra secretions. It'll become reddened and moistened. And remember, the greater vestibular glands right down here would lubricate the opening of the vagina as well. In the male, what will happen is bulbourethral glands are going to secrete that fluid to cleanse the urethra and lubricate the tip of the penis. And then the erectile structures, you'll start sending more blood to the penis than can leave, and the blood gets caught in the penis. And then you go from a flaccid penis to an erect penis. So here is sort of a description of how erection occurs. And this works in the clitoris too, but it's really well understood in the male. So basically, erection is increased blood flow in and decreased blood flow out. Okay. So the arterioles leading to these guys that we call the central arteries, the arterioles dilate due to decreased sympathetic stimulation. You're not stressed out, and increased parasympathetic stimulation. And then the blood flow to the penis when the arousal occurs is about 6 times more than usual. And these central arteries in here, they will fill, and then these spaces will fill with blood. The penis begins to increase in size and push the veins against the tunica albuginea, so they can't actually drain. So the veins that drain the penis are compressed, reducing the amount of blood that can exit. So more blood in, less blood out. This progresses until this sheath, called the tunica albuginea, reaches the limits of expansion. And so the erection will fade when the arterioles constrict again, decreasing the inflow. And when you decrease the inflow, you'll stop putting pressure on those veins and the blood can drain out. And the loss of erection can either be due to a decrease in sexual excitement or ejaculation, or even fear. Sympathetic nervous system is inhospitable to erections. So let's talk briefly about erectile dysfunction. Erectile dysfunction is the inability to either achieve or maintain an erection. We used to think that it was exclusively psychological, but actually about 70% of cases occur because something is wrong physically. Unfortunately, because the sympathetic nervous system is inhospitable to erections, something happens physically, then the sympathetic nervous system adds to the problem, because you're thinking, erectile, I didn't get an erection when I wanted an erection, and then now I'm worried, which makes it less hospitable to erections. So how frequently does erectile dysfunction occur? The last time I looked it up, 2% of men under age 35, about 10% by age 55, and about 50% by age 75. Now, it's not saying that they can never, ever get an erection, just inability to like really consistently achieve or maintain an erection. So what causes an erection in males and females originally? So what is it? Well, it's varied. It could be conscious thought in the cerebral cortex, or visual stimulation of something that you find titillating. It could be REM sleep for some reason. Nocturnal erections happen a whole bunch of times per night. It could be a spinal reflex caused by stimulation of the penis, meaning if somebody touches the penis can become erect. But your brain can override this spinal reflex, because like if there's fear of failure or anxiety or fear of anything, it causes sympathetic stimulation, which decreases blood flow to the penis and can cause constriction of the arterioles. So sympathetic nervous system and erections are just not very hospitable to one another. So regardless of the sex, let's talk about the climax stage. And the climax stage is basically when either sex reaches climax, also called orgasm. In males, that's typically accompanied with ejaculation. Okay, so in both sexes, when you hit the climax phase or stage, the sex flush continues, so you still got excess blood going to the face and the lips, and still pupil dilation. Skeletal muscle starts to contract in the perineum, which for a woman would tighten the opening to the vagina even further, and in males helps to maintain an erection until ejaculation occurs. And then in both sexes, there is intense pleasurable feelings related to the release of some neurotransmitters and hormones. Endorphins, which reduce pain sensation and make you feel very powerful, typically. Dopamine, which rewards behaviors. Oxytocin, which is a bonding chemical, and vasopressin, which is a different kind of bonding chemical. And I'll talk about the difference between those in just a second. So how does the climax stage differ in males and females? In females, remember that when the woman became aroused, the uterus tilted back and the cervix pulled back. When a woman climaxes, the cervix will plunge into the vagina, and also there are peristaltic waves of uterine contraction. Probably all of this is to make it more likely that the sperm gets past the cervix, so it plunges in and then the muscle contracts. And involuntary pelvic thrusting, which occurs in the male as well. And then in some women at least, and there's still a lot of argument about how many women, there is what we call female ejaculation. There's still a bunch of controversy of whether it occurs or in how many women it occurs. And these glands that are homologous to the prostate gland in the women that they exist in, this glandular tissue, a lot of times when this glandular tissue is specifically stimulated, this area right here on the anterior wall of the vagina is often called the Grafenberg spot or the G spot. And when this is stimulated, sometimes the woman upon climax will secrete a fluid, but it won't go into her vagina, it'll go into the distal end of her urethra. So how do you know it's not urine? Well, in the women who do have this, it's actually been analyzed and it has PSA in it, prostate-specific antigen, which tells you that it's probably, and not very much urea, right? Just as much as there was in the urethra at that time. So it occurs definitely in some women, and the secretions that are coming are different than urine. Then in women, upon climax, there is more oxytocin released than vasopressin. I'll talk about these more in class, but oxytocin tends to be a pair bonding chemical, and when a woman climaxes, she releases a decent amount of this pair bonding chemical, which is called oxytocin. It also is released, for instance, during childbirth and during breastfeeding and some other reasons, and we talk about it in physiology a decent amount. She does release vasopressin, but less generally. In males, of course, ejaculation is the rhythmic contraction of the smooth muscle all the way from the epididymis up the vas deferens, the smooth muscle in the seminal vesicle and in the prostate and in the proximal regions of the urethra. All of that rhythmic contraction of smooth muscle all heading outward to cause semen to move into the urethra for ejaculation. This is a sympathetic nervous system response. So it seems counterintuitive that the sympathetic nervous system is really inhospitable to erections, but the sympathetic nervous system is responsible for ejaculation. And in males, in the brain, in addition to all of these chemicals that we talked about here, there is actually more of this hormone called vasopressin released than oxytocin. And oxytocin is more of a pair bonding chemical, and vasopressin is more of a territoriality chemical. I always think of the difference between oxytocin and vasopressin as oxytocin is like, that's my boo, like pair bonding. And vasopressin is more territoriality. And I always think of it as, that's my bitch. And it tends to make males a bit more competitive with other males when they ejaculated. So this is an interesting evolutionary biology question if you want to discuss it in class. Okay, then what happens? So we have just gone through the arousal and plateau stages and the climax stage, and now we are at what's called the refractory period. There is a period of time in males only after one climax that a second climax is not physiologically possible, and that's called the refractory period. It does not exist in women. Women are physiologically, at least, capable of multiple climaxes back to back to back to back to back. In men, the refractory period lasts, when you're 14, it may last minutes. When you're 75, it may last days. It's the period of time between climaxes. And then in both sexes, there is what we call the resolution stage. And the resolution stage is characterized by profound relaxation, a drop in blood pressure, a drop in heart rate, a drop in breathing, muscle tone returns to normals, the genital tissues move back into their original positions. The uterus falls back over to its resting position, the vagina relaxes to normal dimensions, and then the male has a loss of erection. And that is the reproductive system.